Hi, I'm Sharon Schindler Rising. I'm the Executive Director of the Centering Healthcare Institute. And I want to share with you a bit of my excitement for our upcoming third national conference that is going to be held February 7th to 9th in San Antonio. This conference will be preceded by 2 days of pre-conference workshops. We're going to train in all of the different models that we have for centering. But I particularly want to talk with you about our conference, which starts Sunday evening, February 7th. We are having a very unusual format this year that we think will allow for a considerable amount of creative exchange and dialogue among those coming. We're expecting over 200 people from all over the United States and hopefully from some foreign countries as well. These people will be providers, physicians, midwives, advanced practice nurses, social workers, medical assistants, administrators, researchers, educators, all coming together to talk about healthcare. Our theme this year is on the power of connection and really healthcare innovations for reform. So we're going to be starting out Sunday evening with a cafe, really a cafe, round tables, red checkered tablecloths, some candles, some music, coffee and dessert, and with me setting the stage for our 2 days of time together to talk about healthcare reform and innovation. That evening we'll be sitting at these small tables of 4, sharing with each other about why we've come to the conference and what we want to get out of it. We'll be starting out our first morning with our opening plenary speaker, Dr. Tony Sussman from the University of Rochester. Tony is steeped in relationship-centered care, and he is going to talk with us in a radio show format about the difference between our traditional methods of creating change and much more contemporary methods. That will lead us into our first interactive dialogue event, similar to a World Cafe, in which we will be sitting around these round tables, talking with each other about what is a healthy community. We'll be doing a couple rounds of this discussion, and we'll have a graphic artist from the University of Texas San Antonio School of Business working with us to capture our dialogue. Following that will be another plenary address, this one by Dr. Joshua Sparrow of the Touchpoints Institute in Boston. He will talk with us about the internal change that is necessary for us to change how we deliver care. This is a very profound event that happens for each of us, and he will lead us through some thinking about that. Following lunch, we will have time for 2 different breakout sessions, and we're excited about the breakouts that we have. To name a couple, we will be again looking at mindfulness-based stress reduction and how it can be brought into centering groups. We also will have an opportunity to talk with Doug Edwards, who is a gentleman who has developed Real Dads Forever, a dads program that is meant to run parallel and at times intersecting and overlapping with centering pregnancy groups. We are starting to pilot one of these groups in New Haven, and he will be sharing with you some of our experiences with that. We also will have an opportunity for more interactive exercises, working with Sepna Padkey from Teen Empowerment, and then we'll have breakouts on change, on residency, working with residents, and the kinds of system issues that all of us are dealing with, some of them around marketing and branding of our program, the image that we have, and that particular one will be done by an architect who is working with designing the premier centering space in Dallas. Following our breakouts will be an opportunity for our poster sessions, and we're really encouraging you to bring a poster or a storyboard that talks about either your evaluation or research projects or the story of how you have developed your centering program. The next morning, we will be starting with Dr. Diane Rowley, who is at the University of North Carolina, who will be talking with us about an area that she has done lots of study and work in, that is healthcare disparities. Following that will be Bill Walczak, who is a community organizer in Dorchester, in Massachusetts, in Boston, and who has developed the Common Square Community Health Center. He will address the issue of healthy communities. Then we'll have Dr. Stephen Patrick, who is in Dallas at Dallas Methodist, who has developed the centering program at Golden Cross Clinic and in 1 year, and has put this into his residency as well. And during that time, we'll have the first sharing of some of the Texas March of Dimes centering research data. That data will be presented by Dr. Carol Arnold, who is on that research team. Well, ready for lunch, and some greetings from some of our really supportive organizations. And then our closing session, which will be led by Dr. Lisa Summers, a midwife who has been at ACNM and who is now a health policy advisor for the American Nurses Association. She will help to pull together the activities of the 2 days. And by the way, we hope that there will be lots of bright sticky notes that will be on the graffiti paper and the pads all around our meeting room area. She will pull that together and help us to think about, well, where do we go from here? How does all of this fit into the healthcare reform issues that are so prevalent today, and really give us some inspiration to go forward as we go back to our agencies. The closing harvesting session will have Dr. Sussman back to help all of us as we bring it all together. So we are expecting to have a really exciting time in San Antonio. It's a great city. We love the hotel, the Sheraton Gunter, where we're going to be. It has this feeling that just makes us want to sit around and talk with each other. It's an old, intimate hotel. And February, for those of us who are in the north, February in San Antonio has just a really nice sound to it. So we hope that you'll come and join us, help us to think through issues of healthcare, to network with each other. We will have some breakfast breakouts, which will be an opportunity to talk about teens and life cycle and research and diabetes, the kinds of things that you're really wanting to network with other people on. So come, look on our website, join us. The early bird registration is ending soon. Get your registration in. We'll see you in San Antonio in February.